Probably the pinnacle example was chlorine dioxide. So early in my practice, my first year, I started hearing these whispers of this substance or this compound can cure basically everything. And when I read this book, and it was really impressive what it said this thing can do in all the places around the world that were using it. So then I go to PubMed, right, which is the medical database for papers. Can't find anything. And so I'm like, what is this? So everyone here is saying that it cures everything, but there's nothing published. And it wasn't until about a year ago when I started research on my book, because I was invited to a Zoom conference with a network of colleagues, and it was about chlorine dioxide. And I met a guy that I'd done work with from Brazil, PhD, MD, like really impressive guy. And he's in this Zoom. And I realized he's been using chlorine dioxide. So then I was like, oh, there's something here. And now I spent the last year writing this book, and what I have found is that, I'm going to say this, Del, it is the most suppressed medicine of modern times. It has been globally coordinated by public health agencies and media around the world for decades. Thou shalt not bring up the topic of chlorine dioxide. Mm-hmm. There are trails of deaths by advocates, proponents. Research will never get published, although that changed. There's a couple of papers in COVID on chlorine dioxide. And then I found literally the exact repeat of Uttar Pradesh. And you remember the story of Uttar Pradesh in COVID, which is Ivermectin. It's a state in northern India where the chief minister put a systematic deployment program of Ivermectin. They hired 160,000 workers, 95,000 villages. Everybody, they tested. You get positive, you get ivermectin. All the healthcare workers took ivermectin. Anyone in the household of someone tested positive got ivermectin. And the papers literally in India were reporting in September of, I think, 21 or 22, that there was like 241 million people. There was like 60 cases active and no new cases. They literally almost eradicated it through this massively aggressive program on ivermectin. Never showed up in the New York Times. We never heard about it here, right? But there's so much of it. And even in India, it was censored. So when they said, like, the miraculous success of Uttar Pradesh, ivermectin didn't appear in the articles. It was just about quarantining and surveilling. They didn't mention they were giving everyone ivermectin. So guess what? I start to look into chlorine dioxide, and I found the same thing. The entire country of Bolivia, Bolivia was doing really badly with COVID. They hammered, like Peru did at one point. Some well-meaning legislators got a law passed on the urging of some well-meaning clinicians. They passed a law making it legal to manufacture and distribute chlorine dioxide. The military got into it. The universities were manufacturing. People were lining up in streets all through Bolivia taking their little drinks of chlorine dioxide. Mortality and cases plummeted. And I was like, as I'm researching, I'm like, this is Uttar Pradesh all over again. But remember, this is not sufficient evidence still. The fact that a whole country's mortality rates, and there were mayors who were using it in the ICUs, and they were saying we were emptying ICUs of COVID patients. It was, to be honest, what's interesting about this, it's quite humbling, right? I'm supposedly Mr. Ivermectin. Based on all my research, what I know now, if I got COVID right now, that would probably be number one treatment. I would take that over ivermectin any day, knowing what I know of its efficacy. And so, and that goes to your point, right? All the things that we can do for viruses, right? So there's a website called c19early.org, probably the best science in all of COVID, anonymous group. They decided to become anonymous, but the high-level statisticians, systematic reviewers, they did constantly updating on all data trials on all these medicines for COVID. So you had real time, you had all these options. As of now, if you go to that website and you look at the amount of therapies that have statistically significant benefits in COVID, based on 4 or more trials, it numbers 72 different ways to treat COVID.
Wow.
Ivermectin is actually at the top. Interestingly, but there's 72 behind it, and when you use them in combination, but this is like real medicine and science, but it's not allowed to exist.
How much does chlorine dioxide cost?
Oh boy, on Amazon, it's literally you get 2 bottles.
So if you make your own.
Well, it comes in 2. I wouldn't know how to make it because you need the starting compounds. But on Amazon, it's $28 for 2 bottles.
For a huge
you
amount.
could treat your family for probably a year or 2 with those 2 bottles. Yes.